The stomach and pancreas are connected to each other, and it makes sense that any disease process that affects one organ will affect the other. The same can be said for the duodenum, major duodenal papilla, common bile duct, and pancreatic duct. The purpose of this DVD is to help you find and recognize these major organs and some lesions associated with them. Transducer positions and movements will be described as presented in the Tips and Techniques DVD. While examining the liver, the cranial stomach is also on the ultrasound screen. Any lesions of the cranial stomach are usually noted while examining the liver. We need to develop some habits for the exam. Remember to keep the area of interest centered on the ultrasound screen to reduce artifact. This is best accomplished by holding the transducer perpendicular to the patient's body and the organ of interest. Adjust depth to fill the ultrasound screen with the organ of interest. If needed, adjust transducer frequency for the current depth. Adjust gain for the best image. And adjust focal points to the bottom of the organ of interest. Remember to keep one finger of the keyboard hand on the freeze button, ready to capture the best image. When you press the freeze button, practice leaving your transducer hand relaxed and in position so that when you unfreeze, you will still have the same image. This will save you time and effort. We will continue with a 12-pound Yorkie. When finished examining the liver, angle the transducer caudally till it is perpendicular to the stomach and the patient's body. Center the stomach on the ultrasound screen. We need a standard measurement of the stomach wall with every patient, so decrease depth as much as possible to magnify the stomach wall. Search for a place where the 4 layers of the stomach wall can be seen. When you have a good image, press the freeze button and use Cinematic Loop to select the best image. Press Caliper or Measure and place one caliper at the interface between the hyperechoic lumen of the stomach and the hypoechoic mucous membrane layer. Place the other caliper on the outside of the hyperechoic serosal layer of the stomach. Label the image stomach and save the image to the patient record or archive. Unfreeze and increase depth to fill the ultrasound screen with stomach. Slide the transducer caudally to center the caudal wall of the stomach on the ultrasound screen. While examining the liver, we saw the cranial wall of the stomach. Now we want to concentrate on the caudal wall of the stomach and the left limb of the pancreas. The left limb of the pancreas is located between the landmarks of the caudal stomach wall and the transverse colon. Normal pancreas looks like fat, omentum, or mesentery, and usually is not recognized. Slide the transducer to the patient's right side till the stomach disappears. Adjust depth if needed. Then reverse directions and slide to the patient's left side till the stomach disappears. Try to keep the caudal wall of the stomach centered on the ultrasound screen.